Hi, I'm Christina Lindemann, a PA specializing in neurology at UC San Diego Health, back to talk with you some more about migraine. In this video, we will discuss the phases of a migraine attack and the symptoms that might lead us to suspect migraine in our patients. To get started, I want to walk you through the phases of a migraine attack. The first phase of a migraine attack is the premonitory phase, or prodrome. The prodrome can last anywhere from a few hours to a few days. In this phase, the hypothalamic region of the brain is activated, leading people with migraine to experience symptoms such as fatigue, irritability, food cravings, nausea, lighter sound sensitivity, problems concentrating, or difficulty sleeping. The migraine aura is the next phase that can overlap with or start after the prodrome. Some patients don't experience this phase, but for those that do, it typically lasts between 5 and 60 minutes. Aura is thought to be triggered by a wave of altered brain activity called cortical spreading depression and may result in visual disturbances, numbness and tingling on one side of the body, language difficulties, or even one-sided weakness, such as with hemiplegic migraine. The headache phase comes next, and this can last anywhere from 4 to 72 hours. This phase is characterized by activation of the trigeminal vascular system. In this phase, people with migraine can experience head throbbing or drilling, nausea, vomiting, insomnia, mood changes, sensory sensitivities, and neck pain or stiffness. The last phase of a migraine attack is the postdrome, often referred to as the migraine hangover. This phase lasts between 24 and 48 hours and is the result of altered brain blood flow. Patients are often fatigued or find it hard to concentrate and may experience depressed or euphoric mood. As you can see, all told, a migraine attack can last over a week, and each phase comes with distinct challenges for our patients. Let's also talk a little bit about the triggers that can occur between migraine attacks, or in the interictal phase. Some of the most commonly reported triggers are stress, weather, not eating, and sleep disturbance. Hormonal changes, particularly around menarche, perimenopause, and pregnancy, can also impact migraine frequency and presentation. It's important to note that the exposure to a known trigger may not reliably produce migraine attacks, and not all patients respond to the same triggers. I like to ask patients to keep a diary or a journal for their symptoms and potential triggers so that we can look for patterns that may help us understand their experiences and can be used to avoid or treat triggers when possible. As I discussed in my last video, migraine is underdiagnosed. This can be in part because it encompasses many non-headache symptoms, as is seen throughout the phases of a migraine attack. However, there are screening tools to help. One tool is ID Migraine, a 3-item questionnaire for which answering yes to at least 2 items is highly correlated with a migraine diagnosis. The mnemonic PIN can be used to remember the screening tool. To pin the diagnosis, ask about photophobia or light sensitivity, impairment of functioning, and nausea accompanying the patient's headaches. Additionally, due to the genetic features of migraine, a family history of migraine may also be a clue towards a patient's symptoms being migraine-related. In the differential diagnosis of migraine, I'm often considering other primary headache disorders like tension-type headache and cluster headache. However, these are different in some key ways. Migraine headache tends to be unilateral in location and lasts 4 to 72 hours. The pain is moderate to severe in intensity and is often pulsating. In contrast, tension-type headache is often bilateral or circumferential. It can also last hours to days, but is often over within 24 hours, sometimes even 30 minutes. The pain is less intense, more in that mild to moderate range, and the patient usually describes the pain as pressing or tightening. Cluster headache is unilateral and orbital, supraorbital, or temporal. It can last 15 to 180 minutes on average, and the pain is severe and overwhelming. Migraine is often accompanied by sensitivity to light and sound and/or nausea and vomiting, while tension-type and cluster headaches are generally not associated with these symptoms. In my next video, we're going to talk more specifically about diagnosing migraine. I hope you'll join me.